This program is made possible in part by the University of Wisconsin-Milwaukee, one of America's top research universities, preparing students for today's interdependent world with internationally focused academic and outreach programs. The Institute of World Affairs at the University of Wisconsin-Milwaukee presents International Focus, a weekly discussion of the people and events behind today's global headlines. Now, here's your host, Doug Savage.
Welcome to International Focus. The central Chinese city of Wuhan was thrust into the global spotlight as the source of an outbreak of coronavirus. As Chinese authorities attempt to quarantine the area, health officials worldwide are working to contain the spread of the disease. In addition to mainland China, coronavirus cases have been confirmed in several other Asian countries, plus Australia, France, and the United States. To help us learn more about this virus and more generally how the global health community responds when bugs break out across borders, we're joined by two people on the front lines. Joyce Sanchez is a board-certified physician specializing in infectious diseases and internal medicine. Her current practice at Froedtert and the Medical College of Wisconsin includes positions as assistant professor of medicine and director of the hospital's travel health clinic. Nick Tomaro serves as Public Health Emergency Response Planning Coordinator for the Milwaukee Health Department, where he is responsible for developing the department's emergency plans and coordinating assets deployed in health emergencies. I'm sure you're very busy. Welcome, both of you.
Thank you.
Well, let's just talk about the scope of what we're seeing right now. It sounds on the one hand like there's some very large numbers, on the other, maybe not so much. How does this stack up against other recent outbreaks like this?
Yeah, definitely a significant disease outbreak event. At the time we're talking here at the end of January, the numbers are such that right now the vast majority of cases are in the place that this was identified in the Hubei province of China in Wuhan. Very small percentage of those confirmed cases are outside of China right now, but has extended to multiple countries where people have traveled from that region.
So let's talk a little bit about the nature of this virus. I mean, people may remember SARS from the region and MERS from the Middle East. So how does this relate to that?
Yeah, so all of these viruses, including novel coronavirus at this time, are within the same family of coronaviruses. We're very familiar, very experienced with dealing with coronaviruses. The majority of coronavirus infections happening in the U.S. causing a benign upper respiratory illness, the pesky common cold. What's unique about SARS, or severe acute respiratory syndrome, or MERS, Middle Eastern respiratory syndrome, or novel coronavirus now in China, is that it has a propensity of being more virulent, causing more severe disease in the lower respiratory tract. The spiky proteins that encircle the spherical virus tend to attach to and infect lung tissue, the cells of the lung, and that causes a viral pneumonia and more severe illness, particularly in folks who are elderly, those who have comorbid conditions, things like underlying lung damage or heart disease or diabetes.
Well, let's take a look at a few things we've got here, just to give our viewers some sense of what we're talking about here. Here's a map of Wuhan, China. Its position geographically is significant. It's in some ways considered the Chicago of China, if you will. It's a hub for transportation. How does that impact an outbreak like this when you've got travel from the far corners of China going through Wuhan?
Yeah. No, sorry. Certainly, significant from a public health aspect of trying to control an outbreak like this, and certain aspects of when initially the disease was identified, the fact that this is what we call a novel coronavirus, a new coronavirus, and newly identified. After it's identified and understood that this is a new entity being tracked, then you're dealing with obviously a population center that's spreading out very quickly. So as of today, again, several days ago, the Chinese government had curtailed transportation outside of Wuhan, But you have, as you see there, a population of 11 million people in this region. So really significant in terms of trying to control the spread of this virus.
Well, there's an interesting juxtaposition of, if we could look at the next slide here, what the city looks like. This is a very modern place with lots of modern architecture. I mean that could be a large city pretty much anywhere in the world. But the outbreak was really traced back to a particular seafood market, and I think we've got a picture of a typical market. So you see here that I'm sure either one of you would not necessarily give that the stamp of approval for.
Certainly not from a public health perspective, but you're right. So the first cluster of identified cases, 41 individuals presented with pretty severe viral appearing pneumonia, and it was within a couple of weeks really of this cluster being identified that the scientific community was able to identify the virus. This is a perfect setting for which coronavirus or any RNA-related virus, so these are viruses that often can recombine and jump species. Seafood market like this, where there's multiple species that can be affected with a coronavirus, it's a perfect opportunity for DNA, genetic material, to recombine and jump ship from bats to, well, we don't know exactly what the origin of this particular outbreak is, although some surmise bats, to humans.
So we've got just a few more pictures of sort of the aftermath and the response. In travel throughout the region, one of the things that people are doing is wearing masks. Is that a reasonable thing to be doing? I mean, how much protection does that afford you if you're in an area where there's an outbreak like this?
Well, masks certainly help from spreading the virus. So we know, based on previous experience with other coronaviruses, that this is spread through droplet contact. So larger droplets that, after you cough or sneeze, can travel on the magnitude of about 3 feet. And then with contact, so if you contact the surface of an area that has been contaminated with droplets that have coronavirus, then you can certainly have transmission after you touch your face. The masks are helpful to stop spreading. If you're a healthcare worker having close contact with an infected individual, that's also vital in protecting yourself as a healthcare worker. But on the greater level of protecting oneself in the general community, it's really mostly about hand hygiene, hand washing, and ensuring that no infected material, including your own hands, really touch your face where the virus can really start.
Well, let's move on to some basic terminology we hear in the press a lot these days. And you touched on this a little bit about the origins starting in one species and jumping to another. This is a zoonotic disease, I understand. What does that mean exactly?
So as a veterinarian, obviously this is a topic that we talk a lot about. So the majority of emerging infectious diseases in the world are zoonotic diseases. So this is a disease that spreads from an animal species to humans. When you think about certain types of influenzas, and I think important to talk about the fact that in the United States, influenza is still a significant respiratory pathogen we need to be talking about now, and in terms of the same time we're talking about coronavirus, just based on the current threat of coronavirus here. But this zoonotic infection is new, and we have to gather a lot of information in a short amount of time, both from the standpoint of the testing that's being done on the virus as it's isolated, but then also looking at the epidemiologic evidence of what is going on. And we're just in the early stages of understanding how closely, we know it's closely related to the SARS virus and the MERS virus, but the activity thus far has been a little bit different. So we have to see, in terms of a containment and control perspective, some of those aspects of how it's spreading and implement the best practices.
Well, there are 3 terms used in this kind of event. I wonder if you could compare and contrast for us. There are outbreaks, there are epidemics, and there are pandemics. So how do they vary?
Well, I think it's more of a, instead of hard, fast definitions, more of a spectrum. So outbreaks are a novel disease that's hitting a community in a way that it hasn't hit before, causing significant amount of injury to someone's body or death potentially, although it doesn't have to cause death in order to be considered an outbreak. An epidemic is a larger scale, nationwide, and pandemic really spans the whole globe essentially.
So one of the organizations involved, particularly at that pandemic level, is the World Health Organization, and they have the power to declare a public health emergency of international concern, which they have not done so far. So what triggers that typically?
There were meetings early on. You know, these initial days were several meetings, and at this time they have not. And you know, at the time of this will air, that may be very different. But based on the scope of those parameters at that time, the World Health Organization determined it was not at that level. Certainly in specific countries, you know, you have much more significant activities going on. And, you know, us in the United States, obviously incredibly vigilant, looking to the World Health Organization. We look at the international level. Centers for Disease Control and Prevention is in close contact with the World Health Organization from a public health perspective. Then we go down to the state and local level. And just a lot of situational awareness, a lot of information gathering at this point to best understand the outbreak and address it.
So does it have any impact on what the response is? You know, if they do declare the health emergency or don't, I mean, does it trigger anything if they do?
I think the main goal of the World Health Organization is to help give support to existing local and national public health agencies to be able to do their job adequately. And if that's raising awareness to increase funds with, for example, Bill and Melinda Gates Foundation recently funding $10 million in efforts to contain the outbreak and prevent it from going global and help contain things so that the outbreak eventually peters out, then so be it. So their purpose is really to align with governmental organizations so they can accomplish what needs to happen.
Absolutely.
So what about the CDC at the national level here? I mean, what is their role in a situation like this?
Centers for Disease Control and Prevention in Atlanta here, obviously a national organization that takes a lead in these types of situations. And again, taking information from the World Health Organization, and that direction helps the CDC kind of approach the situation and then filter down information to more of the state and local level. So being a local health department practitioner, we are in close contact with information from the Centers for Disease Control and Prevention. We work closely with the Department of Health Services at the state level. Communicable Disease Bureau has been in close contact with us continuously. A lot of conference calls happening. Right now the CDC has set up conference calls on a weekly basis every Monday, and State Health Department is doing something similar. Big symposium tomorrow taking place. So really about their role in providing information, helping direct where the outbreak is at this time, and giving state and local practitioners information to proceed with responding to the outbreak.
So a lot of this seems like it's predicated on the flow of information, both from these large entities down to the individual level, but also more importantly from people like yourself. It's like to be able to track the outbreak of it, you need to know where people are showing up with it, right? So how does that work?
There are a couple of mechanisms by where that works. The first is at the really local level, so individuals who are presenting to clinics or hospitals, emergency departments, urgent care centers with symptoms. What is great about the current state of affairs is that most hospitals have an infrastructure now, policies and procedures in place to respond to the threat of someone who's coming in possibly infected with novel coronavirus. We've taken a lot of lessons learned from the SARS, from MERS, from influenza every year, and we have a way to isolate patients early, test them early, ensure that they're in an area that doesn't put other individuals who are vulnerable in a healthcare setting at risk and healthcare providers at risk. Once a diagnosis is made, either through a local lab or in this case for novel coronavirus, it's sent to the state and then on to the CDC for testing and confirmation of a suspected case. Then that result is brought down to the local communities, and then further contact investigation is done, usually through the local health departments, to trace anyone who may have been exposed so that they can monitor themselves for signs or symptoms and have the adequate information to be able to come in a safe manner that protects healthcare workers and other vulnerable individuals in urgent cares and hospitals.
So how does that impact your shop?
Well,
when someone shows up and Dr. Sanchez says, oh, here it is, it's confirmed this patient has novel coronavirus, what do you do with them?
Yeah, so this is the interaction we have. I mean, we are in close contact always with the hospital systems and healthcare systems in general. Our infectious disease staff basically has a direct line. The hospital and healthcare systems have a direct line to them. In this situation, and there's a number of reportable diseases where if they're suspected, the healthcare system would be reporting them to the local health department immediately. In this situation where you have a novel disease process and outbreak, we would be looking and receiving information immediately for a patient under investigation. So that's a situation where local health department staff would get involved to start what we call contact tracing. And really this is kind of this important function of public health where we're following up on a case. And I think right now, based on where we're at in the outbreak, that's why we're in such good shape in a country like the United States, where we had a lot of lead time to look at what was happening elsewhere and to prepare. And just based on the robustness of the healthcare system in the United States in general and the connectivity of the public health system, we have the ability to identify people that are either fitting the criteria of a patient under investigation, whether they have clinical illness or have again, epidemiologic evidence that they could be a person that could be infected, and therefore follow up on those cases. That's right as of taping, and this could be vastly different, but we have no person-to-person transmission within the United States. That could definitely change, but that is the significant difference in other countries where you have person-to-person transmission. Right now, every case that's been identified has been a person that's come into the United States through travel.
Well, and what about just, you say we're basically in pretty good shape here. We've got a very robust healthcare system. What about some of these other social determinants of health? I mean, how does that impact other countries' ability to respond to something like this?
Well, I certainly can't speak from personal experience of what's happening in China, but there are several determinants, whether it be the amount of individuals per square space, that share ventilation systems that these viruses or bacterial illnesses can more easily spread, to the types of conditions that you saw in the Wuhan seafood market, where the levels of animal-to-animal contact and feces-to-food contact is not quite necessarily the standard that we see here in the United States. And then there's the cultural customs and norms, whereby, here in the United States, the way we process food, the way we investigate foodborne illness, we have a very robust infrastructure that can detect and stop outbreaks from happening of foodborne illness, where I can't tell you exactly what happened in Wuhan in the first few weeks before the virus was identified. I'm sure the government did what it could, and local health authorities did what they could. I know that there's a lot of speculation as to how quickly the government could have responded, but I think at this point we're at a place where there's a little bit more transparency, or at least I hope there is, and I think being able to act on that is going to be important.
Well, that was an issue with SARS, for example, wasn't it? That there was deliberate non-disclosure. So this system is really predicated on people passing the information as soon as they have it to the relevant parties, and that didn't happen.
You're right, and absolutely. I mean, that's a key, when you bring up the World Health Organization. And by reports, after the initial severe case of illness that was identified and connected with this novel coronavirus, the reporting from China to the World Health Organization was fairly rapid. But again, you've got a situation where you don't know there's a new disease present, and you have the majority of people carrying around signs of illness that would be relatively routine. So until you have those more severe cases and testing is performed and you identify that this is something new, it can take some time. But in this case, in comparison to when SARS was identified, reporting was much more rapid.
So we haven't talked a lot about just the severity of this novel virus. I mean, how concerned should people be if they're not in a high-risk group, if you're not elderly or a very small child or your immune system is compromised in some way? Is this something people should be panicked about?
Well, we're still gathering information, and I don't think we've seen the end of the outbreak. I think the story is still being told. As of end of January, what we know is those who are more vulnerable, elderly, tend to have more aggressive disease. Right now we're seeing statistically mortality rate of about 2 to 3%.
And how does that compare to just like common influenza or something?
Sure. Well, by sheer numbers, we certainly in the United States and globally see many, many more deaths. So when we're talking about the seasonal flu this year until end of January, from October, we're talking an estimated 8,000 flu-related deaths in the United States alone. As of end of January, we've only seen just over 100 cases of death related to novel coronavirus. So vastly different in terms of worry and panic. I'd put my money more on seasonal flu. It makes novel coronavirus a drop in the bucket.
Well, one of the things we hear about are the ability of these viruses to mutate sort of throughout the process of the outbreak. So it starts out with an animal being zoonotic and eventually becomes something that humans get. As far as we know, at least here, it hasn't had human-to-human transmission yet, right? If I remember.
Well, strictly, I was just talking about the United States. In terms of the cases that have been identified here, it's basically case history globally has proven human-to-human transmission. Definitely.
And can that change? I mean, throughout the course of an outbreak like this, I mean, can what we're dealing with actually change it at the level of the virus itself?
Absolutely. Coronaviruses can mutate. So can flu. And that can happen at any point. One thing that we try to intervene on is how contagious this virus is, and there are different ways of intervening. From a public health standpoint, educating the public on how to prevent the spread of infection, and on the local level in terms of communities. So what can we do as individuals within our own sphere of influence is extremely important. So hand hygiene, washing those hands before you touch your face, that actually brings down the level of contagiousness, so to speak. Right now, at least the reports are that for every person who is infected, approximately 2 to 3 individuals will become infected as a consequence of that index case. We're hoping to institute containment measures so that that number goes down to less than 1, because with time then it'll eventually burn out. And I think we still have a ways to go. The numbers are still rising at an alarming rate, at least in China. Thankfully not in places outside China this far, but we're hoping that'll change.
So what advice do you have for viewers who may be concerned about this?
Yeah, I think, as Dr. Sanchez said, this is really basic respiratory disease prevention measures at this point. In terms of in the United States, the recommendations we have is if you have traveled from that specific region of China, this is something we have to be, for this presumed incubation period, this 14-day incubation period, very conscious. A lot of the cases that have been identified in the United States have been self-reported, And it's led to very straightforward management with healthcare systems in terms of identifying those individuals, being able to track them, being able to isolate them and test. But again, hand hygiene, covering your mouth with cough, identifying if there are any symptoms, and for other individuals who may have come into contact with anyone who would have exhibited symptoms and had traveled to that region of China. So again, right now in the United States, and really basic measures that are important to look at.
Very good. Well, we'll certainly keep an eye on it, and hopefully you won't be too busy in the days and weeks ahead. Dr. Sanchez?
Thank you.
Very good. Thank you very much. Dr. Tomaro? Our viewers, we'll see you next time on International Focus.
That does go quickly.
This program is made possible in part by the University of Wisconsin-Milwaukee, one of America's top research universities, preparing students for today's interdependent world with internationally focused academic and outreach programs.